Hello, Dr. Vicki Peterson here. I wanted to talk to you today about a very common medication that is used here in the United States. They're called proton-pump inhibitors or H2 blockers. You might know them by more of the drug name, drugs like Prevacid, Nexium, Prilosec, Acifex. What else? Protonics. These are all drugs that really one of the most commonly prescribed drugs here in the United States, and they are prescribed for ulcers, pre-ulcerous conditions, acid reflux. The acid reflux is the most common reason, and they have a side effect, and they have several side effects as most drugs do. But one was a recent study out of Sweden that was published in Digestion and Liver Disease, and just the end of last year, 2013, where it showed that patients who took these drugs were more likely to develop celiac disease than patients who didn't, which is very significant. And when you think about why this would be, I mean, one of the first, I guess, confusions that arise is thinking about, well, if I have the genes for celiac disease, then I have the genes for celiac disease and nothing's going to make any difference. But that's not true. Realize that 30 to 40% of the population has the genes for celiac disease, yet the incidence of the disease, while increasing, is not anywhere near 30 to 40%. So why is that? It's estimated it's not because people aren't eating gluten. Goodness knows that's almost impossible in this country unless you're trying not to. So you have the genes and you have gluten, so what's that third thing that is making the difference? It is the health of the intestine. And one of the side effects of these drugs is it actually makes you more likely to get infections. One side effect is a serious bacteria called Clostridium difficile. It's known as C. diff sometimes is the shortened name for it. And they found that patients on these drugs were 74% more likely, yes, their risk was 74% higher of getting this bacterial infection than someone who wasn't on this. So how does that tie in then to celiac disease? Understand that in order to have a healthy gut, part of that is having a healthy immune system, because most of the immune system, 70 to 80% of it, is located in your gut. So if these drugs are suppressing the immune system, which they apparently do because they increase your risk for infection, they're also then increasing your risk potentially for celiac disease. So the connection does make sense. Anything that's decreasing your immune potential is going to make it more likely for this to occur. And the tie-in is really interesting because the good bacteria of the gut, sometimes we call them the probiotics or the microbiome of the gut, which has these hundreds of trillions of good organisms. These good organisms are known to be able to keep, when they're robust and healthy, they're known to be able to keep bad genes turned off. So it turns out having a gene is not so critical as what the position of the switch is, if you will. So a gene that flips on, then the disease manifests. A disease that, the gene that is kept in an off position, you're fine. So even though you have that tendency or that predisposition to develop the disease because you have the gene, doesn't mean you're going to get it. But that flipping of the switch is very much determined by the health of the gut, the health of this probiotic population or microbiome as it's called. So full circle, what we come around to is that we need a healthy, strong gut, a healthy, strong immune system in that gut, and any medication that you take that's known to compromise your immunity is something you want to be very suspect of. So obviously in a perfect world, you would know you had some leaning toward celiac disease, and you would avoid certain drugs like the plague. That's not as easy as saying it is, certainly. But I think when you also appreciate the fact that these drugs increase your risk for other bacterial diseases like the C. diff, as we mentioned earlier, really what you're looking at is trying to avoid them if humanly possible. One researcher that I saw stated that he felt that 60 to 70% of the Americans on these drugs really didn't need to be on them. And I absolutely concur. I was surprised to find research that supported kind of what we see here, but that is absolutely the case, that usually with diet and lifestyle changes, natural changes, we often are able to handle patients who have acid reflux or GERD, as it's also known. So whether it's heartburn, reflux, those symptoms that typically get that prescription for the Acifex or the Nexium or the Prilosec, you can really handle very naturally in most cases. So we very much see that as well. So food for thought, if you're on any of these medications, you might want to see if there's a better natural approach that you can take to really get a handle of why you have the symptom instead of just masking it with the drug, and in turn take any suppression that's occurring off of your immune system so that you're healthier. And if you do have a predilection towards celiac disease, you know, kind of countering that while your gut's still healthy, hopefully. And certainly if you have celiac disease or any autoimmune disease, you don't want to take a medication that you know is compromising the immune system more. So I hope you found that helpful, and until next time, I wish you very good health.